Okay, go ahead.
All right, our presentation is on the CMS, the Centers for Medicare and Medicaid Services. Medicaid and Medicare are two governmental programs that provide medical and health-related services to specific groups of people in the United States. Although the two programs are very different, they're both managed by the Centers for Medicare and Medicaid Services, a division of the U.S. Department of Health and Human Services. Both Medicaid and Medicare were created when President Lyndon B. Johnson signed the amendments to the Social Security Act on July 30th, 1965. At the bill signing ceremony, which took place at the Truman Library in Independence, Missouri, former President Harry S. Truman was enrolled at as Medicare's first beneficiary and received the first Medicare card.
I'm going to talk about Medicaid. It is a joint federal and state program that helps with medical costs for some people with limited income and resources. Also, it is the largest source of funding for medical and health related services for people with low income in the United States. Primary oversight of the program is handled at the federal level. However, each state establishes its own eligibility standards, determines the type, amount, duration, and scope of services, sets the rate of payment for services, and administers its own Medicaid programs. Now, who is eligible for Medicaid? There are many pathways to being eligible for Medicaid. For example, most states provide Medicaid to anyone who is receiving benefits under the Supplemental Security Income Program. And a number of states provide Medicaid to elderly or disabled persons with income that is below 100% of the federal poverty level. And for the most part, to be eligible for Medicaid, you must be one of the following. Be age 65 or older, have a permanent disability as that term is defined by the Social Security Administration, be blind, be a pregnant woman, be a child or the parent or caretaker of a child. In addition, you must meet certain other requirements, such as be a USA citizen or meet certain immigration rules, be a resident of the state where you apply, and have a social security number. How is Medicaid funded? The Medicaid program is jointly funded by the federal government and states. The federal government pays the state for a specific percentage of a program expenses called the Federal Medical Assistance Percentage. The government pays a part of it and the states pays the other part. The federal government pays between 50 and 75% per state, depending on the per capita incomes of the state. Before CMS approves a state plan amendment, they must verify that state funding sources meet statutory and regulatory requirements, so they can authorize federal financial participation for the covered services. Now I'm going to talk about Medicare. Medicare is a federal health insurance program for people who are 65 or older. There are younger people with disabilities and people with end-stage renal disease. The program consists of two main parts for hospital and medical insurance, like Part A and Part B, and two additional parts that provide flexibility and prescription drugs, like Part C and Part D. Medicare Part 8 is also called hospital insurance. Part 8 covers inpatient hospital stays, care in skilled nursing facilities, hospice care, and some home health care. Part B is also called medical insurance. Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. Part C is also called Medicare Advantage plans, and it is a different way of getting Medicare Part A and Part B coverage. Medicare Advantage plans include health maintenance organizations, preferred providers organizations, private fee for service plans, special needs plan, and Medicare medical savings account plan. Most Medicare Advantage plans offer prescription drugs coverage. Part D, prescription drug coverage, can be a standalone plan, joined with other insurance, or it may be combined with a Medicare Advantage plan, also called a Medicare Advantage prescription drug plan.
Who is eligible for Medicare?
Okay.
To be eligible for Medicare, an individual must either be at least 65 years old, under 65 and disabled, or any age with end-stage renal disease, permanent kidney failure that requires dialysis or a transplant. In addition, eligibility for Medicare requires that an individual is a U.S. citizen or permanent legal resident for 5 continuous years and is eligible for Social Security benefits with at least 10 years of payments contributed into the system. And how is Medicare funded? Medicare is paid through 2 trust fund accounts held by the U.S. Treasury. These funds can only be used for Medicare. Hospital insurance, HI trust fund, is paid for by most employers, and people who are self-employed. Other sources like income taxes paid on Social Security benefits, interest earned on the trust fund investments, and Medicare Part A premiums from people who aren't eligible for premium-free Part A. Medicare Part A benefits pays for inpatient hospital care, skilled nursing facility care, home health care, and hospice care. The Medicare Program Administration, like costs for paying benefits, collecting Medicare taxes, and combating fraud and abuse. The Supplementary Medical Insurance Trust Fund is funded through premiums from people enrolled in Medicare Part B, the medical insurance, and Medicare prescription drug coverage, as well as other sources like interest earned on the trust fund investments. The supplementary medical insurance pays for Part B benefits as well as Part D, and the Medicare Program Administration, like costs for paying benefits and for combating fraud and abuse. One countrywide issue with Medicaid comes from the inability to pay clinics full price in exchange for services. Many clinics claim that they are losing money every time a patient covered by Medicaid walks through the door because the cost of treatment is often greater than what the clinic is paid. Because the acceptance of Medicaid is completely optional, more and more clinics are opting to steer clear of it. This means that Medicaid patients will have a more difficult time finding primary care and professionals who will work with them. And when will it be bankrupt? Well, in 2012, a political advisor to Forbes magazine predicted Medicare would be bankrupt by 2016. It was later stated by the CBPP, the Center on Budget Policy Priorities, that repealing the Affordable Care Act would worsen the Medicare financial situation, shortening its life expectancy. They say that by 2028, the hospital insurance fund will be depleted, meaning that the percentage, now at 100%, that Medicare can pay will slowly begin to decline. I should note that this only applies to funding specifically for hospital charges. The CBPP seems confident that other aspects of Medicaid cannot run out of funds.
Those are our sources. And this is the end of the presentation.
Awesome. All right, great work, you both. You covered the topic really well. I can tell you did a lot of good research, and we're You did a really good job of looking into that. So I typically will ask students at the end of their presentation, what was the most interesting thing that you learned as you were studying this topic? So I'm going to ask each of you that same question. I'll start with you, Natalia, and then I'll ask you the same question, Andrew.
I really enjoy studying about Medicare and Medicaid, but especially how they're founded and how is eligible for these programs. I didn't know about Medicaid and Medicare a lot because I'm not from the United States, but I have heard about it, but I didn't know. I don't know. I didn't know about it.
Oh, great. That's awesome. Andrew.
Yeah, the most interesting thing that I found was definitely the end date of Medicaid and Medicare, when people were predicting that it would kind of die off, because the predictions were so diverse. A lot of people were predicting that, well, like I read that that it would have died last year, and then other people say that it's perpetual and it will never end. And it's interesting.
Great. Excellent. All right, guys. So I'm going to stop recording, but hang on the line for just a second.